Hi, I'm Dr. Jennifer Hobson, Doctor of Physical Therapy. In Chicago and in the United States, I'm known for my successful treatment of TMJ and facial pain, which I've learned from my mentor, Dr. Mariano Roccabato. He's a world leader in this field. It wasn't until my own family, including myself, had issues with breathing that I became aware of the big void that exists in Western medicine around the effects of poor breathing. Two children in the family were diagnosed with swelling in their tonsils and adenoids. It was a shock to me because it was a hidden problem. What I'd like to share with you is how I was able to avoid surgery and heal the children's swelling, and also to alleviate a lot of head and neck symptoms that I didn't realize were caused by issues with breathing. I learned all about the treatment of tongue tie and breathing retraining. Not only that, I would like to share with you the effects of how the tongue can actually contribute to poor breathing, which can affect you at any age. Many don't realize this, but poor breathing can cause asthma, ADHD, anxiety, chronic fatigue, sleep apnea, snoring, GERD, acid reflux, digestive issues, and so much more. The Hobson Institute Breathing Clinic is dedicated to transforming our clients' breathing and educating them about how to reverse these debilitating conditions at any age. We treat children to adults. Do you or your child or your family members suffer from any of these things? Are you always congested? Do you snore? Do you have sleep apnea or use a CPAP? Do you have asthma and have to use an inhaler? You can reverse these things. Do you clench all the time or have ADHD or anxiety? High blood pressure is something you can reduce with breathing retraining. Poor sleep will improve if you train your breathing. So these are the things that I want you to know are able to transform with this type of treatment. Do you suffer from acid reflux or GERD? Feel exhausted all the time? Or do you have a narrow mouth and narrow jaws and feel like your tongue just doesn't fit in your mouth well? Does your child suffer from any of these symptoms or have swelling in their tonsils or adenoids or have been recommended to have ear tube surgery? In the next 10 minutes, we will show you how all of these symptoms can be reversed if you treat the root cause of your problem. Unfortunately, Western medicine in this area of health is not up to speed and is treating these issues with prescription medication, surgeries, and devices such as CPAP, which is really just a Band-Aid, and the individual continues to suffer. I'm coming from the mindset of a physical therapist, someone that looks at the form and proper function of the body and how it's supposed to move and operate. I, like any other mom, would do anything for my child. Our family was not ready to take the doctor's advice and go straight to surgery and cut out the swelling without understanding why it was there in the first place. What was really the cause of this swelling? I spent the last 20 years successfully eliminating TMJ facial pain by restoring head and neck posture through manual therapy techniques and exercise to balance out the upper neck and the jaw position. I've been redirecting the body to properly align itself, which allows it to heal. I know that the body can heal itself when guided into proper function. In my case, and in the children's case, we identified a tongue tie issue and a mouth breathing problem. I was one of those children growing up getting braces that needed 4 teeth to be pulled out because there was no room. I was crowded. Unfortunately, the tongue tie issue is not well understood with doctors or even the average dentist. So it gets undetected, but it can cause a low tongue posture in the mouth, which leads to mouth breathing sometimes. There is a cascade of events that occurs when you lower the tongue and how it affects the forward head posture and tightens the neck and shoulders and causes even narrow jaws. I learned that mouth breathing can cause the lymphatic system to be the first line of defense for the body, causing the tonsils and adenoids to swell. I myself had been a mouth breather from childhood all the way to my 40s, and the children as well. I went from feeling tired all the time as a mouth breather, yawning and sighing with cold hands and feet, to regaining my full energy and the warmth in my body and extremities. The children went from being sick and congested all the time to thriving as athletes and excelling in school with this breathing retraining approach. I'm sharing this with you as it's not a mainstream treatment for these problems. Normally, people are given medication, recommended surgery, only to treat the symptoms, not the cause. Have you ever heard of oral myofunctional therapy? No? Not surprising, I hadn't either until I met a myofunctional therapist at a sleep apnea conference. Did you know that myofunctional therapy and retraining of your breathing can reduce tonsils and adenoid swelling and normalize it without surgery? This combination restores the tongue and body to normal function, and the body heals itself. Myofunctional therapy is like physical therapy to the mouth, tongue, and airway. We train the tongue to properly swallow, to place itself on the roof of the mouth to help support the airway in the throat from collapsing. When these muscles don't function well, the back of the throat begins to fall and it blocks the airway space, and it can happen at any age. Restoring your health takes focus and accountability. We have coached over 3,000 people by focusing on the most important thing, restoring a proper breathing pattern. Through the nose, slow and low, using the diaphragm. Our unique approach encompasses all the previous knowledge of how to restore spine and neck and TMJ, and now we've added breathing retraining and myofunctional therapy of the tongue and the airway. You see, mouth breathing and chest breathing is a big factor of why people continue to worsen and get unhealthier. Medical doctors often overlook this problem 99% of the time. Everybody thinks, I'm breathing just fine, when they're actually breathing shallow through their chest and maybe even with their mouth open and not using their nose. They don't realize that their problems stem from breathing improperly, and the vicious cycle continues. Many of our clients have found that they no longer snore, they no longer need much medication to control their high blood pressure, their GERD, or their asthma. This is what sets this breathing retraining program apart from anything like it in the world. We are going to transform your health by addressing the root problem of breathing improperly. I've been helping people in Chicagoland for many years. I found that many people could improve their ailments with breathing retraining, but behavior modifications are necessary to make better breathing part of their day-to-day life. That's why I created the Breathing Clinic. It's a comprehensive, in-depth, supportive program to support clients every step of the way to truly retrain their breathing. With the Transformative Breathing Program, you will get a customized plan catered to the health and one-on-one support Zoom calls by a personal coach, exercise Zoom practice sessions with small groups, unlimited access to self-paced learning modules, in reinforcing everything we talk about, monthly community Q&As, check-ins with me, and a chance to learn about the journey of others, as well as those in the webinars that we provide. Plus, I email and can text tips and tricks each week during the program. There is no other virtual program like this in the world. This program helps me expand outside of Chicagoland and really drive more awareness about the importance of better breathing. I'm just so passionate about this problem, as I know not many people know about it. They get pushed around back and forth to doctors and they don't get the help that they need. I want to be able to help as many people as I can. The truth is that through the power of your attention, through the guidance and accountability of a personal coach who is teaching you along the way, your health transforms. Many of our clients have improved relationships, especially those that stop snoring and can't actually sleep next to their partners again. They have been able to reduce head and neck tension, clenching, and headaches. We have reduced nose breathing and proper swallowing patterns in adults, and most importantly, children who are still growing, and in turn, it has reduced their tonsil and adenoid swelling and their need for ear tube surgery. Most important thing for children is to grow with their mouth closed so that their mid-face grows properly and that they don't become narrowed in the nose and in the throat. We have been able to reduce snoring in nearly all of our clients and also reduce CPAP for some clients. Sign up for a free 15-minute consultation to talk with me or someone on our team who will show you exactly how we can transform the lives of thousands of people using the Hobson Institute breathing retraining method. We do have a limited number of spots, and that is why it's important to assess whether you're a good fit for a personal coach. We will walk you through everything you have ever tried in the past to understand what has worked, what hasn't, and we will come up with a game plan that is tailored to your needs. We can't wait to see you on the call. Talk to you soon.